I just like this. What do you?
You're right.
Yeah, yeah, I think.
This is the night side.
Oh, quiet. I'm turning the mic off. So let me. Okay. Now the test of microphone number one. On one. Microphone.
Yeah, I didn't move it over to there.
Yeah.
Three. Which one is the testing for live stream? I just heard. Three. Some three needs to come up. Okay.
People hear me? Yes, okay. Thank you so much for coming, everyone. My name is Rachel Closen. I use she, her, or they, them pronouns. And I'm the graduate assistant for Dr. Dennis. Lucky to be in that role. And I'm also a student for the Master's of Social Work program. And we are here this morning. This next portion of our day is the student panel. We're all students, and we are interested in sharing some of our experiences and thoughts and suggestions and recommendations to the CHHS community regarding diversity, equity, and inclusion issues. So I'm going to let everybody just introduce themselves briefly, and then we have some kind of open-ended questions that we can explore with all of you.
Hi, I'm Victoria Simmons, and my second year at the nursing program.
Hi, my name is Megan Gallagher. I am a PhD student in the Interdisciplinary Health Sciences program. My research is in leadership and professional healthcare roles for racial and ethnic represented minorities.
Hi, I'm Skylar Wolverton. I'm in the geography department in urban regional planning. I'm located in Manitowoc, Native American, and I am the president of the Native American Student Organization.
Thanks, everybody. So we're just going to begin by talking about what our overall perspectives and experience are with DEI-related issues in higher education, and specifically at Western in this, I guess you're not in CHHS, Skylar, but at Western. So broad strokes experiences.
Yes, please. I recently joined the student DEI committee, and as an older student, as a graduate student, I was very, very disappointed to hear the majority of younger members in all of their programs expressing dismay that they were one of very, very limited numbers of people of color. And the reason it made me sad was because I graduated from a physical therapy program over 20 years ago. And at that time, I was the only person of color in that cohort. And most of the cohorts above and below probably only contained one person of color, if any. And to come over 20 years, 2 decades, and to see in programs that are newly formed, that are advancing in their degree, to still be hearing some of the same commentary about the poor representation is very dismaying, and it shouldn't be like that.
I guess for me, I always knew that applied. I'm going to speak in terms of the nursing program. I knew that applying for the nursing program, that there are not too many people of color that actually get in, and I knew that my chances were potentially lower than my fellow peers. But still, for me, that was not something that stopped me from still going forward and applying. But I know that is something that stops others and other people of color from applying, because they are nervous that they're going to be judged, that they cannot get in this program due to their race. And then the lack of support as well, that's advertised. And you just don't hear about too many stories of people of color coming through the program. But for me personally, I have overall had a good experience with DEI-related issues, because, not issues, but DEI-related things, because most of the faculty is supportive. Most of them do support their students and care about how they feel, and actually care that we have lives and things happen, and they are very attuned to that we are still people at the end of the day. Yeah, we're trying to be nurses, but we're still people. So I do appreciate that from them. But at the same time, there